How does Clark level determine melanoma invasion? Imagine peeling back the layers of the skin to see how far melanoma has traveled. That's what the Clark level system helps doctors do. It's a way to describe how deep melanoma has grown into the skin. The skin has several layers, starting with the outermost layer called the epidermis. Beneath that is the dermis, which is made up of two parts, the papillary dermis and the reticular dermis. Underneath the dermis is the subcutaneous tissue, which is mostly fat. The Clark level system divides melanoma invasion into 5 levels based on which skin layer the cancer cells have reached. At the first level, the melanoma is only in the outermost layer, the epidermis. This is called melanoma in situ, meaning it has not invaded any deeper layers. It's often easier to treat at this stage because it hasn't spread into the skin's deeper parts. When the melanoma reaches the second level, it has invaded into the upper part of the dermis, known as the papillary dermis. This indicates that the cancer is starting to penetrate deeper but is still relatively localized. At the third level, the melanoma extends to the junction between the papillary dermis and the reticular dermis, the deeper part of the dermis. Moving to the fourth level, the cancer has invaded into the reticular dermis itself, which is a much thicker, denser layer of skin. The fifth and most advanced level occurs when the melanoma penetrates into the subcutaneous tissue, the fat layer beneath the skin. This indicates a more aggressive and potentially dangerous invasion. Understanding how deep melanoma has gone helps doctors estimate how likely it is to spread beyond the skin. Generally, the deeper the invasion, the higher the risk of metastasis or spread to other parts of the body. However, it's important to note that Clark levels are somewhat subjective because skin thickness varies among individuals, and different pathologists might interpret the invasion slightly differently. Today, doctors often prefer a different measurement called Breslow depth, which measures the actual thickness of the tumor in millimeters. This method tends to be more precise. Still, Clark levels are sometimes included in pathology reports, especially in certain regions or specific cases. They provide a helpful way to understand the extent of melanoma invasion and guide treatment decisions. In summary, Clark level helps determine how far melanoma has penetrated through the skin layers, from just the surface to the subcutaneous tissue. This information, along with other factors, helps clinicians assess the seriousness of the melanoma and plan the best course of action. Remember, always consult a healthcare professional for personalized advice and treatment options.